Hi, good morning David. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 2nd of May 2022. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is David Strauss.
And what is your candidate number, please?
My candidate number is 265932271.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
Okay. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What qualities make you a great nurse?
As a nurse, I am committed to prioritizing compassion and care in my interactions with my patients and colleagues. I'm committed to a career that involves continuous learning, and I am confident that the qualities I bring will help make a difference in the lives of others. I also understand the importance of effective communication within my team and always strive to show courage when presenting concerns to doctors and more qualified colleagues.
What methods do you use to prioritize tasks while maintaining outstanding patient care?
At the beginning of every shift, I make a to-do list with the day's tasks. I put the most important things at the top of the list, such as administering medications and reviewing patients' charts. Other tasks that I hope to get to will be at the bottom of the list. The job can be stressful at times, so staying extremely organized is the best way to handle it. During my rounds, I make sure to build a rapport with my patients to understand their needs better. This allows me to give attention to more serious patients and minimize mistakes.
How well do you work as a team of healthcare professionals?
I really enjoy working as part of a team, as I find that different viewpoints help me find solutions to a problem that I may not have been able to resolve myself. I take pride in my flexibility and understand that cooperation is crucial to problem solving. I also believe that respecting my coworkers is of the utmost importance, and I have no issues with taking orders from doctors or senior nurses. In fact, being part of a team motivates me to become a better nurse. My main focus is helping my patients, and I know that multiple perspectives can bring about creative solutions.
Tell us about your growth as a nurse.
Spending the past 4 years in the nursing field, working directly with patients, has shown me just how far active listening can go in making a patient feel comfortable. In my previous role, I was lucky to be mentored by the head nurse on the ward. She taught me how essential it is to apply the same communication skills with senior doctors too. I believe this will help me in achieving my goal of becoming a head nurse.
Give an example that demonstrates your ability to deal with an emergency.
During the first wave of the COVID-19 crisis, information about the disease was rapidly evolving. Our treatment plan was unknown, and resources were being depleted by the minute. In an emergency of this scale, the entire hospital team had to work together. We had to implement a system to prioritize resources for more serious patients. I had to sacrifice my own time with my family to ensure the safety of my patients. Being able to respond quickly and solve problems efficiently helped us take care of our patients.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET-speaking role play. Don't worry if I stop you when the time is up.
Thank you for allowing me to examine you, Mihiraa. Well, before proceeding, could you please let me know in detail about your symptoms?
Sure, nurse, I will. Actually, 4 days back, I felt hot and shivery. But I thought it might be the usual fever. Subsequently, I got a severe sore throat, and I became extremely tired. Due to exhaustion, I can't even get out of my bed. It is the throat pain that I can't withstand.
I am sorry to hear that, Mihiraa. Well, may I know the treatment you have tried?
I tried the usual remedies for a fever. Took over-the-counter medication, paracetamol, thrice a day. Apart from that, I took saline luke water gargling. But these didn't work for me.
I appreciate you for taking the precautionary measures properly. By the way, do you experience any other symptoms?
Actually, nurse, I experienced all the fever-like symptoms. That means, I experienced flu-like symptoms, including body aches and a headache, a temperature of 100.4 degrees Fahrenheit or higher, nausea, and a loss of appetite.
Thank you, Mihiraa, for your detailed information. Can you confirm the details I understand so far, as say?
All right.
4 days ago, you felt hot and shivery, with severe throat pain. You become extremely tired. You experience body aches, headaches, nausea, and loss of appetite. Your temperature measures 100.4 degrees Fahrenheit and higher. You took paracetamol thrice a day and tried saline gargling.
Yes, You are correct.
Thank you for confirming, Mihiraa. Based on my examination and your detailing, I suspect glandular fever for you. I will explain it in detail, for your better understanding.
All right, nurse. You may please.
Glandular fever is also known as infectious mononucleosis. It is a viral infection caused by the Epstein-Barr or the herpes virus. Glandular fever is a contagious disease and is most common among the age group of 15 to 24-year-olds.
Okay. So, what is to be done next?
Don't worry, Mihiraa. As this is the preliminary diagnosis, it needs to be clarified. For confirmation, you need a GP appointment. Your GP will prescribe blood tests, which is essential to confirm the diagnosis. It also helps to rule out other illnesses, if any, that might be the cause of your condition.
All right, I understand that. Well, nurse, you said it is contagious. May I know how it is spread?
I appreciate your question. Of course, I will explain it to you. The information about the transmission of the virus is that it transmits from an infected person through saliva. Importantly, the carriers are often found to be asymptomatic.
Oh, that is a bit complicated. Now, what should I do?
Your situation is understandable. I will recommend some self-care that you have to practice. The first and foremost one is rest. Get adequate rest. Ensure you consume sufficient fluids and stay well hydrated. If you come across pain, take pain relief medication as required. As you said earlier, continue to do saltwater gargle, which will help to clear throat infections. Initially, you don't need any medication.
No medications?
Yes, Mihiraa, medication is not necessary for your condition at the moment. Just follow self-care.
All right, nurse. Definitely, I will follow your suggestions. But, how long will it take for me to get better without medication?
Your question is reasonable. I will tell you the time scale for recovery in a normal scenario. A healthy person with glandular fever will take nearly 2 to 3 weeks to recover fully.
No, it's a long duration. Will I be able to resume my job in between?
Your question is quite natural. Unfortunately, Mihiraa, it is not safe for you to return to work before curing your fever. There are several risks involved in returning to work too soon. There is a high chance of relapse if not cured properly. In addition, it can also cause damage to the spleen, which will lead to further health complications. Therefore, I strongly insist you take sick leave for 2 to 3 weeks and make sure you make a good recovery.
All right, nurse. I understand that.
That's good to hear, Mihiraa. By the way, may I know your willingness for a GP's appointment?
Sure, you may please.
Thank you, Mihiraa. I have booked your appointment. Mihiraa, I wish you a speedy recovery.
Thank you, nurse.
Thank you. That is the end of your OET-speaking role play. All the best.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.